200-990-96. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200-990-96. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health.
And welcome to the How to Stay Healthy show. Here Friday, August 3rd. It's hard to believe. We're roaring through August, and this evening we're going to talk about aging and disability for seniors, with a very important part of our population. Actually, the fastest growing part of our population is the baby boomers, my parents. And, fortunately, no one's getting any younger. I'm not getting any younger either. But the good news is there's a lot of resources available in South Florida for seniors.
Yes, there are.
And without further ado, I want to welcome to the program Gail Gannotta. She's LPN CMC certified, and she's with the Aging and Disability Resource Center of Broward County, which is, our neighbors, but we're on all over, we're on globally, so we're getting the word out. But welcome to the program.
Thank you.
And thank you.
Glad to be here.
Thank you for joining us on this adventure of health. In your opinion, I wanted to ask you this because you're an expert in senior care. What is the single most hardship facing seniors today? Put you on the spot right there.
There's a couple things that come to mind, but I think most importantly is that because people are living longer, they're outliving their money. And I don't think they saw that in their future. And it's frightening, and fear is difficult because it makes them very vulnerable. And
with inflation in the last few years as well, I mean, that affects the finances as well.
Totally, yeah, and everything's going up. Their maintenance is going up, taxes is going up, the co-pays for medication, doctor's visits, tests, food. So it really does cause them to have to maybe give up things, and they've worked so hard and they've waited so long, and now they're having to give up, or they're unable to pay their rent. So I see a lot of people who are looking for assistance, and there's very little assistance with housing. And there's wait lists for any housing that could subsidize.
And daily necessities as well. I know we're going to get into it a little bit later, but your program, your organization also helps out with food assistance in some cases as well. So we do have a food pantry, but that just consists of canned items, and they need nutrition. So I do have other resources out there for pantries, so I do either direct them or I go there and bring them the food items, just so that it's a Band-Aid in between getting them the Meals on Wheels or their food stamps. Important to know. So you're again with Aging and Disability Resource Center of Broward County. It's ADRCbroward.org, and I'll give that out a whole bunch of times during this broadcast. Now, we talked a little bit about seniors and the aging population, but how does your organization help out with people with disabilities?
Right. Well, we have an elder helpline. So if someone was experiencing a need, they could call the Elder Helpline, and they have specialists that answer the phones there and provide the customer or client with the information that they need so that they can start to access the services that are available to them. There's always a eligibility and criteria, so they'll take that information down and then they'll direct them and help them to access the services that are available to them.
That helpline, is there a specific time of day or hours, or is it 24/7?
No, it's not 24/7. It is between 8:30 and 4:30, Monday through Friday.
Okay, so weekdays.
Yes.
And if we get out the number for that helpline as well?
Sure, yes, 954-745-9779.
Now, if people can actually get to the center,
Yes.
Where are you located?
We're located at 5300 Hiatus Road, and that is in Sunrise, Florida.
Okay, great. I know
Yeah.
exactly where that is. That's a great area, Sunrise,
Yeah.
as well. Now, is the program just for residents of Broward County? Is there a criteria? Or is it kind of, do you have to prove that you live in Broward County, or?
Well, I'm very flexible, in what I do, because I go out into the community, but we are a public service area that provides for Broward County.
Okay.
So we take care of the residents of Broward, and Miami has their own area agency on aging.
Okay. And is there a typical age range of people that you help out? Because I saw on the website a little bit about 18 and up. Was that for disabilities?
That's for the chronically mentally ill.
Okay. You help out the mentally ill as well.
Yes, but our age range is 60 and up.
Okay.
Unless you are chronically mentally ill, 18 and over, and of course, if you're disabled, yeah.
We're here with Gail Gannotta, LPN, CMC, Aging and Disability Resource Center of Broward County. The website is adrcbroward.org. I got to tell you, it's a great website. There's a ton of information on that website.
Yes, they did a great job.
I was on there last night and this morning.
We just need more people to know about it, and then unfortunately, a lot of seniors do not have computer access. So, it takes more outreach and going out to the senior centers and the condo communities and the churches and synagogues to get the information out so that they know who to call and how to access services that they need.
And we're going to give that information out during the whole program. And if any loved one, family members want to check into this broadcast at a later date, you can find it at allcountyhealthcare.com. There's a radio tab there.
Great.
All of my shows are there.
Great.
So this will be living up there. And then also, it's always on the iHeartRadio app, so it's available globally on the iHeartRadio app as well. So that's great. And their Facebook page, the sponsor, All County Healthcare, INC on Facebook. If you type that in, you'll get their page, and all of the shows are there. So we have 3 places we keep archives. So if there's any family members or friends who want to kind of go back to this broadcast and find out a little bit more about the ADRC of Broward, they can check it out there. It's the Aging and Disability Resource Center of Broward County. Now, you mentioned a little bit about that you're funded. Who funds the center, and if you could explain a little bit more about how the funding works.
Okay. Well, the funding comes from the feds to the state to the Aging Disability Resource Center, and it is an administrative office that provides all of the services that are in this brochure. So we've got 4 senior centers. We actually have 33 meal sites.
Wow.
Throughout Broward. We have a senior citizen law project. We have transportation, minority builders, Home Touch, that helps with minor repairs in the homes. We've got an array of services here,
And all that info's on the site too. I saw it there.
Yeah, it's great. So, they need to know. We also do Medicaid through our office, and we do long-term care for people, again, who fit eligibility and criteria. And with that, they can get in-home services that diverts them from going to a nursing home. Everybody wants to age in place, and they need to do that with dignity. So, if you can't manage to take care of your personal hygiene or fix a meal or do your own laundry, you're not going to live with dignity. So this long-term care will provide those services in-home. But with that being said, there's an application process, and oftentimes you need an advocate to help you get through the process. And the sad thing that I oftentimes see is that people don't know about this, early enough, and so they go into a crisis. And anytime you go into crisis, it's really difficult to come back from that.
Most definitely.
So we want to get that information out.
One of the things you mentioned in terms of care, when someone is in optimum care, their quality of life is better. And so, if you have a great attitude and everything is, not everything, but most things are going well, it can help with your health as well.
Absolutely, so and a support system. The hardest thing is to be alone and be isolated. Those are the people that I go out to visit, because I go into the homes, and I have my funding from Jim and Jan Moran Foundation.
Oh, they're great.
So they are fabulous, and they've enabled me to be able to go out into the homes, not charge a fee. For the last 26 years that I've been out there doing this service. For the last 8 years, Jim and Jan have been funding me. So, I can get out there and I could go into their homes. I do safety checks on their homes, and then I'm able to help them with their paperwork and get them to the next level where they can actually get the services in their home and live in their homes with the help that they need.
I'll attest to that. I used to be a reporter for the Tribune Company. They own Sun Sentinel and Foreign Publishing Group, who does all the weekly newspapers and the Jewish Journal and the biggest Jewish weekly newspaper in the world, actually. And Jim and Jan Moran Foundation was absolutely amazing. They really checked out in the stuff that they did. So
they're so benevolent.
It's great really to hear. And you mentioned elder law before. We actually had an elder law attorney on the show last Friday.
Oh, okay.
So. And it was just amazing. He worked a lot with the VA and in elder law as well, and he was just a great resource, even on questions on Medicaid and Medicare, which I'm sure you get a ton of Medicare questions as well.
Well, I try to target people who are lower income, and they can't access that, through an attorney, because they wouldn't be able to afford to hire an attorney. And so I get a real satisfaction out of getting them the services, the veterans benefits as well, so that, they don't have to pay a fee.
Okay, great. We're here with Gail Gannotta, LPN, CMC, Aging and Disability Resource Center of Broward County. Once again, the website URL is adrcbroward.org. Just type it in. Put in your favorites. There's a ton of info there. I can't say that enough. I keep on saying LPN, CMC. I never even asked you what are those credentials?
Well, I'm a licensed practical nurse, and I'm a certified geriatric care manager.
Wow, an expert in...
Well, I think the experience comes from being with seniors and being out in the community, hearing their stories, being in their homes. You're in their sacred space, and getting to know what their losses are, and what their needs are, and trying to provide and meet the needs that they feel that they're losing, because there's a lot of grieving going on with seniors.
Well, Gail, hold that thought. We're going to take a quick commercial break, and on the other side, talk a little bit about your Shine volunteer program and a golf tournament coming up that can help the ADRC of Broward. That's the Aging and Disability Resource Center of Broward County on the How to Stay Healthy show.
All right.
County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health.
Hello, South Florida and beyond, and welcome back to the How to Stay Healthy show. Really excited to have Gail Gannotta here. Am I pronouncing that right? I've pronounced it a few different ways.
It's okay. It's Italian, Gannotta.
Gannotta. I should know that. I'm
Okay.
DePino, but I did Ancestry.com last year, and I'm not Italian at all. So
Oh, wow.
I'm everything else.
Oh, that's
I'm like
interesting.
11% Italian, but
Okay.
I got the last name
Yeah,
from somewhere. So
we're all the same in the end.
Gail Gannotta,
Yeah.
LPN, CMC, Aging and Disability Resource Center, Broward County, ADRCbroward.org. Before we took the break, I was asking you a little bit about, I was saying I was going to come back and talk about the SHINE volunteer
Sure.
program.
Great
What is that,
program.
and how does that help your organization?
SHINE is for insurance needs of seniors, and oftentimes seniors don't either understand or know of all their entitlements that come along with their insurance. And they also need to understand the limitations, because what I've experienced is that seniors will be hospitalized and being discharged, and oftentimes they think they're going to get custodial care at home. You know, my insurance company is going to provide me with a home health aide for, ever. And that's usually their wish. But, in reality, someone will come out, but it's going to be limited. And, they need to understand what the limitations are and also take advantage of the benefits. Sometimes they have to be more assertive. They have to actually ask the doctor, I would like to know if I can receive physical therapy. The doctor doesn't see what's going on in the home, so I try to encourage the seniors that I deal with to write down their needs before they go to the doctor's office or call the insurance customer service and find out what all are they eligible for, what are their entitlements, and make the most of what their insurance can provide for them.
So do the SHINE volunteers, do they meet the people at the center, or do they actually go out to the house?
They will go out to different centers and hospitals, and they are also at the ADRC office, and they have clients come there and speak to them. Yeah, I recently had an encounter with them myself because I was needing to know about Medicare and some other benefits that go with Medicare.
There can be a lot of questions in Medicare.
Sure.
We get them in a few months near open enrollment.
Exactly.
Because there's Medicare, there's Plan B, and et cetera, et cetera. So we actually do a few shows. I have some experts on, and we talk about that. So
great. You have to know what you're entitled to.
Yeah.
Absolutely.
And people should always check out beforehand. I mean, now's a good time to check before you get into that situation and know your resources, kind of have them listed out, pass them on to a family or a friend, loved ones as well.
Yeah, have your affairs in order. And the SHINE volunteers make an appointment, and they will be there. And they also will show up at health fairs, and they're happy to share their information and their expertise. A lot of them are retired, and they work in insurance. So
I was just going to ask you that.
Yeah, they're great.
Are you looking for more SHINE volunteers if anyone hears this?
Always,
Okay.
yes.
Nice.
Yeah,
So,
it's great.
if you're looking to help out,
Great way to do
people in South
service.
Florida, our seniors.
There's something else that the ADRC provides, and that is training for classes. They provide classes in regards to preventative care in self-management, diabetes. It's a wellness program. And there's no fee for that, and they will come into a assisted living or a condo community or any kind of a class where they can do a class and provide self-management, diabetes, chronic illness, and balance exercises. And we get a great response, and we get great feedback on those classes because it's all in prevention. And I think people are aware now that prevention is the key to staying well and living healthy.
Preventative medicine is the backbone of our healthcare right now. I mean, and it's got to be. And a great point there. Balance is huge when you're aging, because that one fall can trigger a whole downfall. I mean, we've had a lot of neurologists on the program talk about that, even neuropsychologists. And if there can be measures put in place to help people out, or even, like you said, if people can come out to the home and kind of make sure the home's safe, that's huge as well. And it's not the first thing people think about,
No, well,
but that could be life or death, unfortunately.
You become so comfortable in your environment. If you bought an apartment or a home 20, 30 years ago, or even 10 years ago, and now you're physically changing, or you may have had an accident, or you came down with a chronic illness, and now your environment is not serving you because there's barriers there, that need to be either, made accessible, so that you can continue to live there and manage independently and safely. So there are ways to do that, but whenever I go into the home, I always do a safety check. It's even a matter of throw rugs can be a potential danger,
Yeah, anything to prevent a fall.
Yeah.
We're here with Gail Gannotta, LPN CMC Aging and Disability Resource Center of Broward County. Once again, great website, adrcbroward.org. Your program can also help out, your organization, I should say, in all your programs.
Right.
But can also help out with congregate meal sites, which you mentioned before, and food pantry, and also maybe even food stamps.
Absolutely.
If seniors, qualified for that as well.
Yes. We help them apply for the food stamps as well as Meals on Wheels. There's 33 in Broward County congregate meal sites. But you have to apply for those, and become registered, and then you can go there. And it's also social, which is very important for lone seniors. So they get to share a meal, they get to socialize, and it keeps them stimulated and obviously healthy.
Got to keep the brain stimulated.
Yeah.
Socializing is an important part, quality of life. Now, ADRC Broward also helps out with support groups. Do you host support groups, or kind of get people the right information to get to those support groups, maybe the actual individuals or family or friends?
The Elder Helpline will direct anybody, and the Elder Helpline provides information in Spanish, in Creole, and I believe Portuguese.
That's
great.
And
we have a community that's extremely diverse.
Very.
So, and they will also direct people to the senior centers where there is support group. And we fund those senior centers. So there's support group at the senior centers as well as counseling.
Nice.
Yes, yeah. So that is really a great service there.
Yeah, well, could you give out that number before, because I know you have it memorized?
Sure, 954-745-9775.
And it's also on the website, too, adrcbroward.org. You see the picture of the nice lady answering the phone there.
Right,
I remember that from the website.
Yeah,
so it's right there.
We've got a great staff at the ADRC, and everybody is dedicated to, helping seniors, and they are there to, give anybody and everybody the right information, as well as we keep depends there, and I keep medical equipment there. I do ask anybody who wants to donate medical equipment. I go out and I'll pick it up and then give it back out because it's durable, and we keep it there at the center. So when someone comes in for maybe help with a program or information, a lot of times they show up because we do pay electric bills if you qualify twice a year for a lot of the seniors, but they could also grab a bag of Depends as well as a walker if they need one, or a cane, or a wheelchair. So we do try to give them, whatever it is that they're needing at that time when they show up, or if they call in, I'll bring it to them. We want to ensure that people are getting what they need, and they're not falling through the cracks.
You're a great resource.
Thank
we have
you.
about 2 minutes left, so I'm going to go to the speed round. But there's a way that our community of listeners and viewers can help. It's the upcoming Swing for Seniors golf tournament, October 26th.
Yes.
6th.
Yes.
Let me say it again. October 26th, Jacaranda Golf Club.
Yes.
I did see that. I'm a golfer, so
all right. Yeah.
definitely.
Yeah. Great fundraiser.
So there's info on the site. People can kind of register there.
Yeah, if you could go to the site, you'll see where you can register, and we also have other events like our Broward Aging Network Conference, which is always
you have a nice calendar there. I saw with all of them.
Yeah.
The whole, even into 2019, there's events already lined up.
Yeah,
that's great.
My director, Edith Letterberg, is so dedicated, and she makes sure that the agency gets all these fundraisers, and we're there for the people. So. Well,
maybe sponsor of our program, Lou Biasi, may want to play golf and get me in that foursome. We can get Freddie in there. Maybe John or Peter as well. We got about a minute left. We actually knocked out a whole bunch of questions I had, but elder abuse prevention training, that's another thing that ADRC does.
Yeah, so when I developed my program, it was in prevention of abuse, neglect, and exploitation of the elderly. So there is a hotline number, and it is the Adult Protective Service number. That's 1-800-96-ABUSE. If anybody has a suspicion, we are all mandatory reporters here, so we need to make that call. 1-800-96-ABUSE.
Thanks again, Gail.
You're
Great
welcome.
interview. I really appreciate all the info.
Thank you.
Check out adrcbroward.org. Have a good evening.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsor